Hi, everyone. Welcome to Calm Mind and Healthy Body, our channel. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. Welcome to today's video. Testosterone is a crucial hormone in the human body, playing a significant role in various functions such as muscle mass, bone density, and sex drive. However, some individuals may experience low testosterone levels, leading to conditions like hypogonadism. In such cases, testosterone replacement therapy, TRT, may be recommended to restore hormonal balance and alleviate symptoms. While TRT can be beneficial, it is essential to understand the potential risks associated with this treatment, including its impact on heart health and hair loss. Testosterone is often called the male hormone, although it is present in both men and women. In men, testosterone is primarily produced in the testes, while in women, it is made in smaller amounts in the ovaries and adrenal glands. This hormone is crucial in developing male characteristics, such as facial hair, deep voice, and muscle mass. Additionally, testosterone is essential for maintaining overall health and well-being. Hypogonadism is a condition characterized by low testosterone levels, which can result from various factors such as aging, certain medical conditions, or genetic disorders. Symptoms of hypogonadism may include fatigue, decreased libido, erectile dysfunction, and mood changes. In some cases, TRT may be recommended to address these symptoms and improve quality of life. While TRT can be effective in restoring testosterone levels and alleviating symptoms of hypogonadism, it is essential to be aware of the potential risks associated with this treatment. Studies have suggested a possible link between low testosterone levels and an increased risk of heart disease. Therefore, it is crucial for individuals considering TRT to discuss the potential cardiovascular risks with their healthcare provider. Understanding these potential risks and side effects is essential for making informed decisions about testosterone replacement therapy and ensuring the best possible outcomes for overall health and well-being. Understanding hypogonadism. Hypogonadism is a medical condition characterized by low levels of testosterone in the body, which can have a significant impact on overall health and well-being. This condition can affect men and women and may result from various factors, including genetic disorders, aging, or certain medical conditions. In men, hypogonadism can be classified as primary or secondary. Primary hypogonadism occurs when the testes are unable to produce sufficient levels of testosterone due to factors such as genetic abnormalities, injury, or infection. Secondary hypogonadism, on the other hand, is caused by issues with the hypothalamus or pituitary gland, which regulates the production of testosterone. The symptoms of hypogonadism can vary depending on the individual and the underlying cause of the condition. In men, common symptoms may include fatigue, decreased libido, erectile dysfunction, muscle weakness, and mood changes. Women with hypogonadism may experience symptoms such as irregular periods, infertility, reduced bone density, and changes in body composition. Hypogonadism can have a significant impact on various aspects of health, including sexual function, bone density, muscle mass, and overall well-being. In addition to the physical symptoms, low testosterone levels can also affect mental health, leading to mood swings, depression, and decreased motivation. Testosterone replacement therapy, TRT, is a standard treatment option for individuals with hypogonadism to restore testosterone levels and alleviate symptoms. TRT can be administered through various methods, including injections, patches, gels, or implants. It is essential for individuals considering TRT to work closely with their healthcare provider to determine the most appropriate treatment plan based on their individual needs and health status. Still, like any medical intervention, it has potential risks and side effects that must be considered. Understanding these risks is essential for making informed decisions about TRT and ensuring safe and effective therapy. Common side effects of testosterone replacement therapy may include acne, fluid retention, and mood swings. These side effects are typically mild and may improve as the body adjusts to the treatment. It is essential for individuals undergoing TRT to communicate any side effects with their healthcare provider so that they can be addressed promptly. In addition to common side effects, TRT has been associated with more severe risks that require careful monitoring. One of the primary concerns is the potential impact of testosterone on cardiovascular health. Some studies have suggested a possible link between TRT and an increased risk of heart attacks, strokes, and other cardiovascular issues. It is crucial for individuals considering TRT to discuss their cardiovascular health history with their healthcare provider to assess the potential risks and benefits of treatment. Another serious risk associated with TRT is the potential for prostate enlargement, which can increase the risk of conditions like benign prostatic hyperplasia, BPH, or prostate cancer. Regular monitoring of prostate health through screenings and exams is essential for individuals undergoing TRT to detect any changes early and address them promptly. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking and excessive alcohol consumption, can help reduce the risks associated with TRT and promote overall well-being. This hormone helps regulate blood pressure, cholesterol levels, and blood vessel function, all essential for a healthy heart. Imbalances in testosterone levels, such as low testosterone, can impact these cardiovascular functions and increase the risk of heart disease. Several studies have linked low testosterone levels to an increased risk of heart disease. Research suggests that men with low testosterone may be more likely to develop conditions such as coronary artery disease, heart attacks, and strokes. Low testosterone levels have been associated with risk factors for heart disease, including obesity, insulin resistance, and inflammation, further emphasizing the importance of addressing hormone imbalances for heart health. Addressing testosterone levels is crucial for maintaining heart health and reducing the risk of cardiovascular issues. For individuals with low testosterone levels, hormone replacement therapy may be recommended to restore hormonal balance and improve cardiovascular function. Optimizing testosterone levels may improve blood pressure, cholesterol, and overall heart health. In addition to hormone replacement therapy, lifestyle modifications such as regular exercise, a healthy diet, weight management, and stress reduction can contribute significantly to heart health. Maintaining a healthy lifestyle and addressing testosterone levels can help reduce the risk of heart disease and promote overall cardiovascular well-being. Overall, understanding the impact of low testosterone on heart disease underscores the importance of monitoring hormone levels and addressing imbalances to support optimal heart health and reduce the risk of cardiovascular issues. Dealing with hair loss. Hair loss is a common concern for many individuals, and testosterone levels can play a role in this process. Understanding how testosterone impacts hair growth and loss, as well as the effects of testosterone replacement therapy, TRT, on hair, is essential for managing this issue effectively while undergoing hormonal treatment. Testosterone can influence hair growth and loss through its conversion into dihydrotestosterone, DHT, a more potent form of the hormone. DHT can bind to hair follicles, leading to miniaturization, hair thinning, and loss. While testosterone is essential for the development of male characteristics, including facial and body hair, an imbalance in hormone levels, particularly in excess of DHT, can contribute to male pattern baldness. When considering testosterone replacement therapy, individuals may be concerned about the potential impact on hair. While TRT can help restore testosterone levels and alleviate symptoms of low testosterone, it is essential to be aware that some individuals may experience hair loss as a side effect of treatment. This is particularly relevant for individuals genetically predisposed to male pattern baldness. Managing hair loss while undergoing testosterone treatment can involve various strategies to support hair health. Here are some tips for individuals experiencing hair loss during TRT. Consult with a healthcare provider. Discuss any concerns about hair loss with your healthcare provider to determine the underlying cause and explore potential solutions. Consider hair loss treatments. Various hair loss treatments, such as minoxidil or finasteride, may help promote hair growth and prevent further loss. Maintain a healthy lifestyle. Eating a balanced diet, staying hydrated, managing stress, and regular exercise can support overall hair health. Use gentle hair care products. Avoid harsh chemicals and treatments that can further damage hair follicles and contribute to hair loss. By understanding the relationship between testosterone levels, hair loss, and testosterone replacement therapy, individuals can take proactive steps to manage hair loss effectively while undergoing hormonal treatment and promote overall hair health. By being aware of common side effects, such as acne and mood swings, as well as more severe risks, like cardiovascular issues and prostate enlargement, individuals can work with their healthcare providers to mitigate these risks and monitor their health throughout the treatment process. I encourage you, as viewers, to take action by subscribing to our channel, liking this video, and sharing it with others to spread awareness about testosterone health and related topics. By engaging with informative content and staying informed, you can empower yourself to make informed decisions about hormone health and overall wellness. Thank you for watching, and remember to prioritize your health and well-being.